So I thought we'd talk for a few minutes about what is the difference between a regular shoulder replacement versus a reverse shoulder replacement. Kind of funny names, okay? Why do we do them? What are their advantages? What are their disadvantages? Who's a candidate? So let's look first at this one. So a regular shoulder replacement, what do we do? So in a regular shoulder replacement, you kind of have normal anatomy, okay? What we're seeing here is just the bones. We're seeing the socket and we're seeing the ball. What we don't see is the rotator cuff that kind of goes around this whole structure. Okay, but first let's look at these. In a regular shoulder, we have worn out, we've become arthritic between the glenoid, or this socket that sits on the end of the shoulder blade, and we've become worn out on the ball on the top of the arm, the shoulder here. When those two have worn through, I guess it's this way, when they have worn through that cartilage that caps those two bones, they're now touching bone on bone. That is arthritis, that is pain. I get some people who I just go to lift that arm, let's move that out, and I can just hear it just creaks. It creaks, it can just really get worn out. So on a regular shoulder replacement, we come in and we are going to make a cut across there. We put a stem down the inside of the bone. That stem is there just really to hold that ball in place. Then we recreate that. We put a new smooth surface here. On the shoulder blade side, we're going to come in and we use a reamer to kind of ream out smooth, and we drill some peg holes and we cement in this piece of high density polyethylene right here. Those two now articulate. They become a nice smooth surface. We've got smooth surface against smooth surface. It does great to get rid of pain. Okay. Now, for us to be able to do that, we've got to have something to hold this ball in this socket. Okay, there's really no ligament crossing right here, right? That's holding that in there. What holds it in is the rotator cuff. Okay, the rotator cuff is 4 muscles that come off of this shoulder blade. They come over and they cover that ball. There's one in the front, there's one in the back, and there's 2 on top. As long as you have a good functioning rotator cuff, you want a regular shoulder replacement, because it's going to hold that ball in that socket while we're moving around. Well, let me get my hand out of the way there. So it is going to hold that in there and have it move just like your natural shoulder does. Okay. Now what happens if we don't have a rotator cuff? Okay, so what I'm going to do is we're going to simplify it. We're just going to talk about this top muscle. Okay. Here's this beautiful rotator cuff that we just created. So the red shows this muscle, okay, muscle that's coming off of the shoulder blade right here. The muscle turns into tendon, okay, turns into that white tendon. That's how our muscles attach to the bone, through a tendon. So it comes across and it makes this top one. Now again, I told you have one in the front, you have one in the back. They kind of make a cuff or a sleeve of tendon. But right now we're just going to focus on this top one. If we tear this tendon, okay, that's attached to the end of the ball, or to the end of the shoulder right here, if we tear that, muscle keeps pulling that away, because muscle's always pulling, right? So if the rope is attached on that end, the rope lets go, muscle keeps pulling that in, it's going to pull that tendon away. Okay, when that tendon is not there, well, what happens? What really moves the shoulder? The big muscles, the deltoid, the pectoralis, the latissimus muscle. The big muscles move this shoulder. All right, so here we've got a big muscle. It comes off of this shoulder blade, kind of what you feel, the lateral corner here. So it's attached here. That is going to move this shoulder. It attaches way down the arm like that. So what does the deltoid do? The deltoid lifts up, okay? So as long as you have a rotator cuff that's holding that ball in the socket, it just pivots, okay? The normal function, the deltoid is attached way down here. It fires, it contracts, it lifts up, the ball stays in the pivot point, and it just rotates. That's how your shoulder's supposed to work. As long as you have a rotator cuff on top, that's going to happen. Now what happens if you don't have a rotator cuff here on top? Well, then this deltoid muscle, okay, that's coming over the top, it's going to fire. This ball isn't necessarily going to stay in that pivot point. There's nothing on top to hold it. So the ball shifts up a little bit while it's trying to lift. That's why a really bad rotator cuff tear, people oftentimes kind of only have this right here, okay? Some people have enough of a ligament connection here on top that they can have a torn rotator cuff they can still bring their arm up. But when you load that arm, when you put a gallon of milk out here, boom, they just don't have that strength. So if that's the case, we've got a torn rotator cuff here on top, we can't go in and just put a regular ball in, okay? Or you're gonna have instability. That ball is gonna move around and move high. So that's where someone who's much smarter than me designed this reverse shoulder replacement. And they said, well, let's take the ball, we'll put it on the cup side, and we'll take the cup, we'll put it on the ball side. Okay, it sounds crazy, but here's why it works, okay? By taking this ball and putting it where the cup used to be, we've now created, let's think of it simply, we've created a barrier, okay? So now, when this arm bone gets pulled on by the deltoid, it can't slide straight up. It is now blocked by that ball. So it has to pivot around like we want it to, okay? That's kind of the simplified way it works. It cannot just slide up like it would if we had a regular ball, right, with a socket without a rotator cuff. So it can function, because we still have a deltoid that works, right? And so it can function by being pulled up. It has to go around the ball, and now our shoulder works like it's supposed to, even without a rotator cuff. Same basic concept. We've got a stem that comes down inside. Let's see if we can pull that apart. So the stem goes in. You can see kind of in this clear plastic how we fill the canal. And then there'll be a polyethylene liner, which is just a fancy medical grade plastic that's designed to wear and wear. And that's really, people, where the advancement has been in these last couple of years, is making these plastic surfaces last so much longer than they used to. So again, that becomes the humerus. Where we used to have a half a ball on this side, we've now gotten rid of that half ball and we've put the cup or the socket on that side. Where we used to have a socket with a regular shoulder replacement, we've come in and we've put in this ball. Now, we didn't know how this would do, okay? Meaning, if you look at that shoulder blade, it is a pretty thin structure, right? And so we put 5 screws, okay? Different systems use different numbers, but we put several screws in here to hold it. If that has a problem, if we break that, okay? If we wear something out and that has to come out, there's not a lot of room left to put something back in. So we don't want to put these in if we can avoid it in someone who's young and active, someone who may wear that out. Because, again, the fixation's kind of limited. So that's the difference we have between our reverse shoulder replacement right here, okay? Reverse shoulders for someone who does not have a dependable rotator cuff on top versus our regular shoulder replacement, which is awesome and just what you want if you've got a good rotator cuff. So there's the difference. Sometimes we'll even use these. A side note, if someone breaks the ball on their shoulder, okay, someone who's in a bad accident and they have multiple parts to this piece, we've now gone in and found, hey, we can do this reverse shoulder replacement, and people tend to do very well because you don't have to have that rotator cuff heal perfectly, which often doesn't happen after someone has the top of that ball smashed into multiple pieces. So regular shoulder replacement, reverse shoulder replacement, now you know what they are when we use them.